Every year, thousands of women are treated with Gynecare Thermachoice to resolve the problem of excessive menstrual bleeding. Gynecare Thermachoice is used in a minimally invasive, non-hormonal treatment for heavy periods and is usually a permanent solution. And because Gynecare Thermachoice requires no incision and just local anesthesia, more and more women are taking advantage of this treatment in the comfort and security of their own doctor's office. And the procedure is covered by most insurance plans.
When I met with my doctor, the suggestion he gave me for what to do about this challenge with my periods was this procedure. He explained to me that it would at least lessen the flow and lessen the amount of pain that I had.
My doctors and nurses here made me feel very comfortable. They were right by my side, holding my hand. If I got nervous or had any pain, they were right there for me. So I loved having it done in the office.
The importance of my familiar surroundings, of course, probably kept me a little more relaxed. Kind of more like a family situation because I've been with this doctor for a period of time, but even if I hadn't, the procedure was so pleasant that it didn't feel awkward.
It saved on hospital bills. The cost was very minimal, and my insurance covered it. And it was just a lot easier than having to go to the hospital.
As you prepare for your in-office treatment, you'll probably have some questions about what to expect during the procedure, as well as the recovery afterward. Your doctor and staff are the best sources of information. They can address any concerns you may have and explain exactly what will take place.
The morning of your surgery, you need to be certain to have a full stomach, eat a good breakfast, bring your medications that your doctor has prescribed, and you need to have someone to bring you home.
Treatment with Gynecare Thermachoice has been performed since 1997, when it was approved by the FDA, and has been used in more than 500,000 women worldwide. Your doctor has confidence in this treatment and wants you to be fully informed. Knowing what to expect will help ease any concerns you might have. Here's what happens during the procedure. A small, soft, flexible balloon is inserted through the cervix and into the uterus. The balloon is inflated with sterile fluid and heated. The fluid is then circulated inside the balloon for 8 minutes while the lining of the uterus is treated. You may feel pressure or warmth during the cycle. After the treatment is completed, the balloon is deflated and removed. There is no incision and nothing remains in the uterus.
I just put a clamp on your cervix. How was that?
That was fine.
Okay.
From setup to completion, the entire procedure takes approximately 30 minutes, and the treatment time itself takes about 8 minutes.
You okay?
Yes.
All right.
During the treatment, you may feel some cramping as with a period, but appropriate pain management medication will be available as needed before, during, and after your procedure. Pain can range from none at all to what you might experience with your menstrual cycle.
So this isn't even as bad as the cramps where you're taking Motrin and Aleve right now.
Right.
And you have 1 minute and 2 seconds left.
Patients vary, but the office staff will do everything possible to make you comfortable.
Guess what? We're done.
I can't believe that.
Your doctor may suggest taking an anti-inflammatory pain reliever such as Motrin or other medications before and after being treated. Following the schedule as directed by your doctor is very important.
It was actually much easier than what I expected. I expected a lot more pain, and it was nothing really. It's just some discomfort, I guess is what I would call it, instead of pain. So it's definitely manageable.
The procedure went exactly the way the doctor explained it would. Very easy. I came in the office and did what he said, and I was done within, from the time I entered the office and the time I left, I was done within like a couple hours. And then I did take it easy that day because he told me to. But then the next day I was fine to go ahead and carry on with my regular activities.
I did have pain when I went home for the first few hours. My doctor prescribed me a little bit of a stronger pain medicine, and by the next day my pain was relieved, and I just took Motrin basically for about a week.
I feel pretty good, really. I mean, just relaxed, calm, no pain at all right now. Pretty awesome.
All surgical procedures present risks. However, Gynecare Thermachoice has a low rate of complications. Gynecare Thermachoice is the only treatment of its type with a proven track record of over 10 years. Treatment with Gynecare Thermachoice is intended for women who do not wish to have children in the future. Pregnancy after being treated can be dangerous for both woman and baby. Gynecare Thermachoice does not prevent pregnancy and does not protect against sexually transmitted diseases. Effective birth control is required after treatment. Some women who have abnormal anatomy or other unique situations may not be able to complete this procedure, and women who are allergic to silicone are not appropriate candidates. For those women who completed the procedure, 95% studied 5 years after treatment with Gynecare Thermachoice had normal bleeding or less. Some even had no bleeding. And approximately 3 out of 4 women studied experienced no menstrual pain or cramping 5 years after treatment.
If I had known how easy the procedure was and how comfortable I would feel before and after, I would have made the appointment much sooner.
It surprised me that I was able to do my activities the very next day, because I wouldn't think that after a procedure such as this that you would be able to do that, but it was very easy.
I had the procedure 8 months ago, and so far I've had no more periods, no cramping, a little bit of PMS, a little bit of bloating, ultimately no bleeding, and no cramping, and it's great.
I guess what surprised me most about the procedures when I went into it, I just expected the flow to be less and the pains to be less, but there's several months I haven't had any period. And it was about a year ago when I had the procedure, so.
It has really surprised me because I didn't expect to have my periods gone without surgery, without a major surgery. And a lot of women are afraid of hysterectomies, and this is a great alternative to hysterectomy.
After treatment, most women will continue to experience only mild bleeding, and nearly 2 out of 3 women reported mild or no PMS symptoms at 3 years. And in the 8 minutes it took to view this video, your treatment would already have been complete. To learn more about this treatment, including insurance information, speak with your doctor. Visit endheavyperiods.com or call 1-888-GYNECARE to speak with a nurse. The patient opinions and outcomes in this video may not be representative of all patients. Gynecare Thermachoice treats the uterine lining to control excessive bleeding due to benign causes in women who don't want to become pregnant. Most common side effects are discharge, cramping, nausea, and vomiting. As with all procedures of its type, there's a risk of infection or injury to the uterus and surrounding tissue.